مساء الخير جميعا. السلام عليكم ورحمة الله وبركاته. احنا راح ننتظر حوالي 5 دقائق حتى نبلش. مرة ثانية مساء الخير جميعا، يعطيكم العافية، وإن شاء الله أنكم تكونوا كلكم أموركم تمام. إحنا بنمر في مرحلة شوي غريبة، أول مرة بتصير من فترة طويلة كتير، وأول مرة بتصير في العالم اللي إحنا بنعرفه اليوم، اللي هو العالم في عصر العولمة، في عصر الاتصال السريع جدا واللي ما بيحتاج لأي وقت حتى يصير، وحركة الناس سريعة جدا، معظم العالم تقدر توصله في أقل من 24 ساعة. اليوم راح نحكي عن سبب المرحلة اللي احنا عايشينها الفترة هاي، واللي ممكن نسميها بكرايسيس أو بأزمة العالم كله بمر فيها. راح نحكي عن الكورونا فيروس، عن الكوفيد 19 a little bit in details, and we will try to tackle different aspects. الديزيز نفسه، الفيروس، الترانسميشن، signs and symptoms، الcontagion تاعه. We will talk a little bit about all of this. اللي بدي أطلبه منكم إنه إذا في أي سؤال نترك الأسئلة للآخر حتى أقدر أشوفها على الكومنتس. So please keep all the questions until the end so I can get them all and I can answer all of your questions. So we will start now. So my name is Ahmad Hamdan. I'm an associate professor in periodontology in the School of Dentistry at the University of Jordan. I like microbiology. I like virology. That's why I'm talking about this topic to you, my students, now. And I hope this will be helpful and it will add some information to all of us. So we will start, first of all, we will start about some definitions. The first one is, what is an endemic? An endemic is a disease that affects a population or a country very specifically and is maintained at a certain level. So it is not propagating throughout multiple populations or countries. An epidemic is a disease that is spreading rapidly in a population, a country, or multiple countries. And if you remember, at the beginning of the pandemic that we are living today, it was categorized as an epidemic in January and maybe until early February. And later on, it started to be called, the WHO, the World Health Organization, started to call it a pandemic. And what is a pandemic? It is an epidemic of a disease that is spreading throughout many regions, countries, and even continents. This is what we are living now. And another definition or another term that you might have heard of is outbreak. An outbreak is the earliest event in the process. It was the first case, the patient 0 in the animal market in China. This is what we call the outbreak. And then it will proceed into an epidemic and a pandemic, which we are having now. Having set these conditions or these definitions, we will go into a little preview of the history of pandemics. It's not the first one in humanity, in the history of humanity. Actually, it is one of among many others. As you can see here, we have the earliest records are in the years 165, 180, with what they call the Antonine plague, and then plague of Justinian, Japanese smallpox epidemic, and one of the most known is the yellow fever and the Spanish flu in the years 1918 and 1919. And it was one of the most severe pandemics affecting our planet. So it's not COVID-19 is not the first pandemic. Humanity is experiencing pandemics since the beginning. And actually, it is related to our life as humans. Many of the diseases, the infectious diseases affecting us, actually they occur because of the transmission from animals into humans, because of the sedentary lifestyle that we have. We are in close contact with animals, and these microorganisms, viruses and bacteria, some of bacteria, they have the characteristic of adaptation. They can readapt themselves. They can modify themselves to be adapted, to be able to be adapted to many different species. And this is one of the causes of the different pandemics that we have. And according to the number of victims to the death related to the death toll, the Black Death or the bubonic plague in the Middle Ages, it caused, according to the historical records, up to 200 million victims. The smallpox, 56 millions, Spanish flu, 40 to 50 millions, and we go until we find here the COVID-19 that is causing about or more than 60,000 victims as of today. I don't have the exact number for today. So HIV is or can be considered as a pandemic since the 1980s, and it has led to the loss of 25 to 35 million lives. So let's talk a little more in details about the coronavirus that we have today. Actually, it is called the SARS-CoV-2. It is the severe acute respiratory syndrome coronavirus 2, because we have the SARS-CoV-1, which has its outbreak in the years 2002 and 2003. So this is a virus that belongs to the coronavirus family. It is a zoonotic family. Most of the viruses are affecting animals, mainly birds. Or some of them are affecting some birds, some bats, many species in the animal kingdom. Regarding humans, it is the seventh virus that has an effect on humans. We have the MERS coronavirus, the Middle East Respiratory Syndrome. Its outbreak was in the year 2012 in the Kingdom of Saudi Arabia. We have the SARS-CoV coronavirus with its the SARS disease, the outbreak in 2002, and the coronavirus 2 causing the coronavirus disease that we are having now. We have other four coronavirus viruses that are related to very mild symptoms, common cold or flu-like symptoms with very mild symptoms. So we have 7 coronaviruses that affect humans. What is peculiar regarding this virus is the fact that it is a single-stranded RNA virus, as all other coronaviruses. It is a positive sense coding virus, which means it reads from the 5' end to the 3' end, meaning that it looks like the messenger RNA. And as you all know, the messenger RNA is the part of the genome that codes for protein translation. We have the transcription from the DNA that is in the nucleus. We will create the messenger RNA, which will be translated later on into proteins. So it looks like it is very similar to the messenger RNA, and this means that it can occupy, it can hijack the ribosomes. Ribosomes as you remember, are the protein producing organelles inside the cells. So because of its composition, it's genetic composition that looks like the messenger RNA. It is able to easily integrate the protein production mechanism inside the cell that will start producing its proteins, leading to the replication of the virus. And because of its RNA genome, it can undergo easy mutations that usually affect the spike protein and the accessory protein. And actually this happens because of the weaker proofreading mechanism that we observe with RNA viruses compared to the DNA viruses. So easy mutations and RNA genome, that looks like the messenger RNA of our cells. This is a schematic presentation from one of the papers published on the coronavirus. The transmission occurs through the jumping between species occurred from the bats. It looks like there's an intermediate host, that is the pangolin, and then it went into humans. Then human spread or human to human transmission started. So this species jump, occurs because of the capacity of the virus to mutate, and because of the close contact between these different species. How does the infection happen? As you know, viruses are not living organisms. They cannot stay active, or they cannot be viable or active unless they are invading or infecting an organism. Because a virus cannot replicate outside a living cell. It needs the living cell, it needs the organelles of the living cells, the biological mechanisms that are, or the cellular mechanisms that are present inside the cells to be able to replicate and remains active. So what happens is that the spike protein, that is a surface protein on the envelope of the virus, needs to be attached to a surface protein on the cell surface of our cells. And this receptor is the angiotensin the ACE2 receptor, the angiotensin converting enzyme receptor. It is a surface enzyme, and the spike protein needs to be cleaved at a certain site to be able to create the internalization of the surface of the virus, and the entry, to allow the entry of the surface into the surface, into the cell. So the spike protein will attach to the ACE2 receptor to allow for its entry inside the cell. Once it's inside the cell, and there is another surface protein, actually surface enzyme, that is called furin, that will allow also the entry of the virus inside the cell. So additional information regarding the specificity of this virus, we talked about the RNA genome that is similar to the mRNA, and the capacity of mutation. Third is the fact that this virus, as all other viruses, uses two surface proteins on the cell to be able to enter it and start its replication. So it will use the ACE2 receptor and the furin, that is not presented here, and it will enter the cell. It will start the uncoating, and then it will occupy the ribosomes that will start the translation of the genome, production of the protein, and then the assembly and budding of the proteins of the virus and the genome on the endoplasmic reticulum, and then the Golgi apparatus, and then the virus will be reassembled and it will be released from the cells again. So this is the life cycle of the virus. This virus, this life cycle of the virus will lead to the disease that we know under the name COVID-19 or SARS-CoV-2. What are the signs of the symptoms of the disease? Because before talking about the signs and the symptoms of the disease, this disease is a new disease, which implies that we are learning while we are dealing with it. This is the life in medicine. When you have a new disease in this amplitude, with this severity and difficulty affecting all the world, you have to learn while you work. What we know now is that it has an incubation period of an average 1 to 14 days. Some cases might go beyond that, but most of the reported literature talks about an incubation period between 1 to 14 days since the point of infection until the point of having symptoms, of developing symptoms. And because of all of that, it has a complex symptomatology. The signs and symptoms evolve every day. And if you follow the news, if you consult the WHO website regularly, you will see that the symptoms evolve and every day. I put here almost all the reported signs and symptoms until now. We have the anosmia, the loss of smell. All of you who heard about that, as well as the ageusia, loss of taste. So the patient, and usually these are the first two symptoms. Patients, they start to have an impairment or complete loss of their smell and taste, especially during the first days after infection, before developing further symptoms. And some reports talked about conjunctivitis. And most probably conjunctivitis could be the result of the fact that the patient is touching his or her mouth and nose and then rubbing his or her eyes, which might lead to conjunctivitis. Other reported signs and symptoms, especially during the earlier stages of the disease in January and February, they included sore throat, GI symptoms, headache, and fatigue. Although, especially these three, fatigue, GI symptoms, and sore throat, are not that common, and some of the reports, some of the institutions, the CDC, the WHO, are removing some of them every day, along with our increased understanding of the disease. The three signs and symptoms, the three symptoms that are more related to the disease are fever, as you can see here in this schematic presentation that I take from the CDC, Center of Disease Control in the United States. Fever, cough, and usually cough is dry, and with the development of the disease, we have the shortness of breath or dyspnea. And these symptoms, as we said, may appear 2 to 14 days after exposure, and not all patients will have the same symptoms. So symptoms might include or can include any of these. Many patients at diagnosis will have mild to moderate disease. According to the literature, 80% of the patients will have mild to moderate disease. 15 patients will have severe presentation of the disease, and unfortunately 5% of the patients at the diagnosis will present with critical clinical presentation, meaning severe shortness of breath, incapacity to take breath, and high fever, affecting the daily life, the basic daily life of the patient. The progression of the disease, 10 to 15% of the mild moderate cases might become severe, and 15 to 20% of the severe cases will be or might be might become critical cases. Furthermore, from the exposure to the symptom onset, we talked about almost 14 days, but usually we are talking about 5 to 6 days after incubation. So the patient got the contact at T0 or D0, day 0. He or she will develop the symptoms within 5 to 6 days from that day. And usually the symptoms start with mild headache, dry cough, and they will increase in severity with time, unless the patient is among the 80% of the patients that will have mild presentation. And we are talking now also about asymptomatic patients that might have no symptoms at all. And then, so in the mild cases, mild or asymptomatic cases, between symptoms and recovery, we almost have 2 weeks. That's why you hear that cases start to get out of hospitals now, because they spent or they completed the 2 weeks of disease period. In the more severe cases, we talk about 3 to 6 weeks. 3 to 6 weeks with 1 to 2 weeks that are red. The patient will be in a red zone where he or she might need intubation or assistance in respiratory function. External assistance, machine-based assistance in respiratory function. In the very critical cases, we are talking, unfortunately, about a certain percentage of loss of lives, of death, and this might intervene between 1 week to 2 or 8 weeks from the point where the patient became critical. That's why we talk about a critical zone here in the severe cases, where the patient might become critical, and then he or she will go back to more or to a safer period where he or she can recover from the disease. We are talking about 1 to 3.4, I think, 1 to 3.4 or 4% of death rate. We will talk about that a little bit later, because the death rate is different actually based on the screening of patients. Some countries are doing high screening. They screen all patients, whether they have signs or not. And that's why, like in Germany and in South Korea, they are screening many patients, even those without signs and symptoms, on the basis of a contact to a known case, even if they don't represent symptoms. And in that case, we have a high number of positive cases, but very low number of critical cases and death. And in other countries, most of other countries, they screen only or they test only positive patients or those who have signs and symptoms. So we cannot talk about very precise death rate regarding the COVID-19 now, because we need this crisis to end, to recalculate. Epidemiologists need time to recalculate all that, because they cannot calculate the definitive rate before ending the outbreak and the pandemic, because they need to know all the cases, symptomatic, asymptomatic, and all the categories of patients. Again, just to remind you that please keep questions until the end of the presentation, so we can I can have all of them. I can have them all in the comments side. So, what are the populations at risk? First of all, patients with systemic diseases. And when we say patients with systemic diseases, it is unrelated to age, because what we know now is that older patients, they can recover from the disease if they have good health. But unfortunately, and that's why age is one of the risk indicators or the risk factors for the disease, is because seniors, older patients, they tend to have more systemic diseases, or they have some comorbidities. So we talk more about patients with systemic diseases. I don't know if you already heard about two patients, one I think in Italy and one in Spain. Both of them, they have 100 years or 103 years, they recovered from COVID-19 because they had no other systemic diseases affecting them. Younger patients, unfortunately, they did not survive because of comorbidities, because of other systemic diseases affecting the immune system. Smokers are at higher risk because smoking modifies the immune system. This is one point. And because smoking modifies the respiratory system, which means that they are more prone to acquire the disease, and smokers tend to present more severe clinical presentations of the disease. Another risk indicator is being a male. So studies are showing that 56, 52, 56, 58% of the patients are males. Maybe this is related also, we don't have explanations now. This needs, as I told you, we need to settle down. We need to finish all this period so we can talk about risk factors and risk indicators about the diseases. But most probably because males tend to be smokers more than females, although this trend maybe is becoming to change nowadays. Another population is children. Children are not at risk at the same level as adults. So children are at low risk and they present milder disease. However, children are part of the disease transmission. So children are important in the disease transmission cycle because most of them, alhamdulillah, thanks God, are asymptomatic. Although we heard some reports about adolescents or very young children or infants who did not survive the infection. So let's talk a little bit now about the COVID-19 transmission. We have different modes of transmission of the disease. The WHO are talking about contact transmission, and here I am citing the contact. So it is a face-to-face contact with a probable or confirmed case within 1 meter and for more than 15 minutes. This is from the situation report that the WHO publishes every day regarding the situation of COVID-19. Or a direct physical contact with a probable or confirmed case. So we have contact, direct contact with a case, droplet, and droplet transmission needs a close face-to-face contact, and the WHO is talking about more than 15 minutes, within 1 meter. That's why we talk about keeping 1 meter, and our Minister of Health is talking about having 2 meters to be to be safer. Fomite, and fomite here we mean transmission by touching a surface. You touch the surface, you will get the virus in your hands, and then you will touch your face, nose, or mouth, which will put the disease in the respiratory system. Then close range aerosol, as we talked, it is related to contact transmission. Sorry. And then we talk about airborne transmission or fecal transmission. Fecal transmission, there is no report. I think there is only 1 case report in the United States, and I'm not sure about it. Regarding the airborne transmission, it is still debatable. Many of the studies that were done and people are talking about actually used an aerosol producing machine that contained particles that have the same dimensions of the virus, and they spread the aerosol, and then they tested the environment during the next few hours, and they stated that it might remain there for 3 hours, 6 hours, or 8 hours. However, infectious disease specialists and respiratory disease specialists, they talk about the fact that the aerosol production from the human being is so different from that produced by aerosol. ومع ذلك, the advice is to put on masks if you can. When you go out, put on a mask just to be on the safe side, because we are still learning how the virus is behaving when it is airborne. It might remain there for a few hours, it might remain there for more than that, we don't know yet, and it might not stay in the air for long periods of time. It will fall down on the floor, and it will be transmissible by fomite route. When we talk about disease transmission, we need to remember the chain of infection. And we all talk about breaking the chain of infection. But what does that mean? First of all, let's just have a small preview on what is a chain of infection. Chain of infection starts here. When we have the infectious, at the outbreak, we have the infectious agent that will be placed in a reservoir, and the reservoir is the place in which the infectious agent lives, grows, and reproduces. And in our case is the respiratory tract. It will be in the saliva, and this is in the early stages of the disease, and this is important for us as dentists. Then it will go in the upper respiratory tract, and then in the lower respiratory tract. So it is in the respiratory tract, mucous membranes, and the saliva of the patient. So once it is in its reservoir, it will need a portal to exit from the infected person to be able to go to infect another person. And this portal of exit is the way that the infectious agent, that the virus, needs to leave the reservoir. Once it goes to, it leaves the infected person, it needs a modes of transmission. It needs a way to travel from the first patient to the next one. So we talked about an infectious agent that entered an organism, established itself in a place. It will need a way to go out, and it needs a way to travel the distance between the first patient, the next patient. And here we are talking about airborne, droplet, contact, fomite, or other routes of transmission. And then it needs a portal of entry. It went from the first patient, and it needs to enter the next patient, the other patient. That's why we talk about taking care of cleaning our hands, cleaning our hands properly, not touching our faces, because this virus, coronavirus, needs its portal of entry is the nose and the mouth. And then once it is inside the susceptible host, it will start to cause the disease. So this is the chain of infection, and we need to cut it. We need to break this chain of infection by cleaning our hands, washing our hands properly here, so the infectious agent cannot get into our bodies. In case of a patient who is a confirmed case, he or she needs to wear a mask to prevent the virus from exiting the body, being quarantined, so the patient cannot get into contact with other patients. So here, wash your hands, put on your mask, quarantine here and here. Same thing, quarantine. So the patient can, in case of a patient, and here, stay at home. Wash your hands, put on a mask, and stay at home. And we are still talking about patients or individuals who are not patients. They don't have COVID-19 yet. They don't have the virus. So you stay at home to break this chain of infection at this point. And in case of necessity, you need to go out to buy a few things to remain alive, or if you need to go to work because you have to put on a mask. Next, the COVID-19, the SARS-CoV-2, is following the SIR model of disease transmission. We have a group of susceptible patients who are in orange. Among them, we have few cases that are infected. With time, these few infected individuals will infect many patients who were in the susceptible population. And with time, some of these infected population people, they will start to recover, or, God forbidden, die. They will be removed from the chain. Many of infectious diseases follow this scheme. And in many cases, one of them is the coronavirus 2, is we have another group that is exposed, which increases the speed or the easiness of transmission of disease. These patients who are exposed, they were susceptible, they get into contact with these infected people, they are asymptomatic, or they did not develop symptoms yet. With time, they will become infected. So we are talking about, and this group is the group that will lead to the spread of the disease. That's why governments are telling people to stay at home. We all need to stay at home. We all need to respect the guidelines set by governments and by health institutions, because this is the only way to reduce the population of this group, the exposed group, because these are unaware of the fact that they are positive and that they can transmit the disease. This is what can happen if we go to the shop and we will be more than 10 in 5 meters squared room, all of us trying to buy even necessary things. That's why we need social distancing. That's why we need to be 1 or 2 meters apart from each other. In case if I or my neighbor is exposed. What about the treatment? I'm not an expert, so I will go. I will mention the most common and the most popular treatment modalities that are being proposed now, that are being investigated now. We have supportive treatment. If we are in the mild cases or some of the severe cases with minimal shortness of breath, flu-like symptoms, we go with supportive treatment, vitamins, rest, because other than that, in severe cases, they will go into intubation and assisted respiration. Other modalities, we have the hydroxychloroquine and the azithromycin that is being investigated now in many countries. We have the antiviral drug, the remdesivir, and these two, they have effect on the replication of the virus, and the hydroxychloroquine have a certain effect on that will inhibit the entry of the virus inside the cells. Other opportunities or other portals of treatment that might be available, because they are investigating it, is the BCG vaccine, or they are trying this now, the plasma of the recovered patients. They take the plasma that will be rich in antibodies from recovered patients, and they will inject it into positive patients to help them to create antibodies that will help them to combat the virus and the disease. And specific vaccines directly targeted or specifically targeted against the COVID, the coronavirus itself. The difficulty the challenge in finding a vaccine, and that's why it might take some time, as we all heard, it might take up to 12 or maybe 18 months, is because of the fact that it is an RNA virus. It is a single-stranded RNA virus that uses human proteins to enter the cell and to replicate. This is a challenging point regarding vaccine development, because many of RNA viruses, they need time. Scientists need time to develop stable vaccines because of the challenges that we talked about related to RNA viruses. Talked about all that, what do we need to do? First of all, wash your hands. Please, please, please wash your hand correctly. Washing your hands should take at least 20 minutes, covering all the surfaces, all the angles, or the all your hands. And you have this figure that I've taken from the WHO website, so you can find it easily on the WHO website, which is who.int international. When you go out to buy goods, to buy food, you need to take care of all the surfaces, because, and this is again from the website of the WHO, the virus stays for different times on different surfaces. On wood, it might stay up to 4 days. Plastic, same thing, up to 4 to 5 days. Glass, it needs 4 to 5 days. Paper or cardboard, up to 24 hours. Surgical gloves, 4 to 5 days. That's why, and I will come back to this again, stainless steel, it can stay for 48 hours. Surgical gloves, or it can stay for 4 to 5 days, and on latex gloves, it might take the same period of time. Meaning that when you go out to buy things and you put on your gloves, please don't answer your phone once you get inside the shop. You use the gloves to protect yourself. We don't want the gloves to become another way of transmitting the disease. We need the gloves to protect us when we go out into a place. I need to buy bread, I need to buy water, I need to buy food for my family. And I am not sure regarding the environment where I am going, if there was any patient who is asymptomatic or who is still in the incubation period, in the exposed group, who was there before me. So if I put on my gloves and then I take my gloves back to my home, or before that, and I touch a surface that was touched by a patient, I'm bringing the virus with me back home. So when you put on the gloves, put them on correctly and get rid of them properly. You put the gloves on when you touch surfaces or when you are in an environment that you don't know, and once you finish that, you take them off and you dispose of them properly, so you are not at risk and your community is not at risk. This crisis should teach us how to think collectively and not being selfish. If I am not sick, if I do not contract the disease, this is good. But if my neighbor is having it because I am not respecting the proper hygiene methods, because I am not thinking collectively, next week I will get it. We need to think collectively. We need to protect ourselves. I need to protect you, and you need to protect yourself and me at the same time. And above all, we need all to stay safe. We need all to stay at home. This is very important. And I've seen some questions. I will get back to them later on. I finish my presentation. And one of them related to our job as dentists. We need to stay at home for the time being, seriously. unfortunately, we all will be affected. We all will be affected financially, but we need to respect the guidelines. We need to respect the restrictions that we have now to be to be able to shorten the period of time that we will be out of work. Finally, I need you to remember, because this is very important regarding the situation that we are living, and this is what I tell my students every time. Remember, science is not a religion. It's not because somebody is saying something that we all need to follow. Science is evolving. Science changes every minute. People did not think that hydroxychloroquine might have an effect. It is having an effect. Same example. Many people did not believe that hydroxychloroquine would be effective. So if we put that into voting, hydroxychloroquine will fail, will lose. But science is not a democracy, so you need to check what you hear. You need to verify what you hear by reading. You need to test to be able to find the appropriate solution. And remember, science does not make sense. It's not the same sense that we use in everyday life. Science has its own logic, because many of us, and I think many of you, have seen many videos regarding this outbreak or this pandemic. One of them is talking about earth electrification. We are talking here about science. It's not because, and the video is making sense, is making complete sense. But viruses are not poisons that are getting out from cells. Viruses are organisms. It is an envelope with the genome inside it that are here since millions of years. So be sure where you get your information. You need to read, and remember, we need to divide each difficulty into as many parts as is feasible and necessary to resolve it. Because if we will look at the problem every time, every moment in its global image, we will not be able to solve it. We need to divide it, and this is what is happening now. Some people are trying to find the best solution to treat those patients who are in critical situation by developing new respirators, by using the same respirator for many patients, or using some of the diving masks, modifying them to be able to use them in hospitals. Some other people are working on developing new treatments or using old treatments. And some people are working on making this social distancing thing easier to live. And please, always read to be able to find the best solution. احنا في الأمة هاي, we need to read. We need to read, because this is the only way that we can move the world. Thank you very much. Now we can start answering the questions. I will start by the first question. Before answering all of them, some of them I might not be able to answer them, so I will provide you with my email at the end before leaving. If I don't have the answer because it's not, I don't have it right now, I might be able to get back to you with a proper answer later on through email. So the first question, yes, we are talking about 14 to 18 to 28 days. It depends on many factors, but on average, the incubation period is 1 to 14 days. But yes, some people, especially those who have better immunity or for other reasons that I don't have knowledge about them, might go up into 28 days. The next question, is there a relation of increased susceptibility to COVID-19 by taking antihypertensive drugs? Furthermore, what about hydroxychloroquine and its effect on G6PD patients? Thank you, Bara. Antihypertensive drugs, actually, they talked about some relation regarding the effect of some antihypertensive drugs on the ACE2 inhibitors, but it is a complex relation actually, because the relation is complex. But the advice is that don't stop the drug. You need to continue it, or the patient needs to continue it, and he or she needs to get into contact with his treating physician, because ACE2 inhibitor actually, no, it might be a factor that might, and this is what they are talking about. It might help not to. It might help to reduce the virus replication. Hydroxychloroquine and its effect on G6PD patients. As I told you, it's not my field of expertise, but I think what they are doing now, especially in France, because I know the details about the hydroxychloroquine use in France, is they do a screening of the candidates for the hydroxychloroquine, and then they use it in a hospital setting. Hydroxychloroquine is not to be used in an auto-medication form. It is not an auto-medication. It can only be used in a hospital setting under professional supervision and surveillance, because it has some negative side effects that are difficult to manage, and they cannot be managed in the absence of a physician. The next question is why children have milder symptoms. From what I've read, I think the cause is not known yet. Maybe because they have a certain mechanism that allows them to bypass the disease, or it is mechanisms. They are talking about some mechanism in the immune system that allows children to not to have symptoms. دكتور محمد بيسأل إنه علاقة المريض بشغلنا, the relation of the disease to our job. As we talked, we need to break the chain cycle, the infection chain cycle, or chain of infection. Breaking the chain of infection involves being at home. Now we are talking about aerosol. The aerosol, we are not sure yet whether it can be used, whether it can be a source of infection or not. But the WHO is talking about being in a close contact with a patient for more than 15 minutes. And most of our procedures, they take more than 15 minutes. So being in a close contact with our patients for 15 minutes at least, this makes us at a higher risk of acquiring the disease. ولو لا سمح الله صار معنا الديزيز, we might be at a higher risk of transmitting the disease. So it might become a focal point. A dental clinic might become a focal point. We need to be more patient. We need to stay aware, to stay up to date for the next few weeks, because they are working on guidelines regarding what to do in a dental clinic. And in post-corona situation, now in this active period, I think we need to stay at home. This is my personal belief, based on information and knowledge that I have acquired during the last few weeks. Because we are dealing with an invisible entity, the virus we cannot see. I cannot be sure that it has been transmitted to me or not. Because it's not only through nose and mouth. It can be through touching any surfaces, or maybe it can, and some reports are talking about acquiring the disease through other surfaces. Just give me some time to be able to go through the next question. How the plasma of other people not being attacked by the patient immune system? it is the plasma. The plasma في عندنا شيء اسمه blood transfusion, في عندنا شيء اسمه plasma transfusion. It will not be attacked by the immune system because it's free of cells. It has no cells. So it is rich in antibodies, and في reports يعني encouraging انه it might help patients to recover rapidly. Reinfection cases صراحة I am ما عندي معلومات. فعبد الرحمن إذا بتحب يعني you can send me this question again in email, وأنا إن شاء الله I will try my best to find a solution. بس أنا ما عندي معلومات لهلا لأنه most of the reports are talking about developing some immunity to the disease. فإحنا ما بدنا نطلع على very sporadic cases of reinfection. It's better to talk about the global image, and the global image is telling us that many patients, they are not reacquiring the disease, or they are not being reinfected again. Is there a proper way to clean any items being purchased outside the house? Fahad, the best way is to follow the guidelines. يعني use any material. في two materials. I think just give me 1 minute اطلع لك اطلع لك الماتيريالز. There are few materials and they are talking about ethanol for when you need to rinse أو مش to rinse يعني to clean and to leave the material on the surface for 1 minute. We are talking about 70% ethanol, 0.5% hydrogen peroxide أو 0.1% sodium hypochlorite, Clorox. And if you don't have hydrogen peroxide, إما كحول, ethanol, alcohol for 70% at least, أو 0.1% Clorox. Why is it difficult to find a vaccine for the virus? Because it is an RNA virus. RNA viruses are more difficult or are more challenging regarding viruses. As you remember, when we talked about it, we talked about a virus that uses natural, our proteins to get inside the cells. It uses the ACE2 enzyme and the furin enzyme. both of them are surface enzymes on the surface of the cell. The virus uses them through the spike protein of it. يعني السبايك بروتين تاعه في sequence that can attach to the surface enzyme, and this attachment, this adherence between the spike protein and the cell, the surface protein on the cell, will allow the virus to get inside the cell. So developing a vaccine that will not influence the cell, that will not have an influence on the cells, is challenging. And the fact that the virus mutates makes the process a little bit more challenging. Dr. Qusay بيسأل, do you think we are just delaying the numbers of infection, or truly we can get 0 cases at least in our country by the government restrictions? Again, Doctori, I am not an epidemiologist, but from what I've learned, what we are looking for is, we are talking about flatten the curve, flatten the curve. What does that mean? It means that we need to keep the critical cases below a certain threshold that will allow the healthcare system to deal with them. I don't think that we can talk about 0 cases in the coming few months. What we are trying to do is to maintain the cases that will need critical care below that threshold of the capacity of our healthcare system. لأنه what is happening in Europe, unfortunately, especially Spain, Italy, now France is on the same track, the United States, is the fact that the curve is not in its flattened part, the curve is in its peak. And this means that the number of critical cases is higher than the capacity of the healthcare system to take care of them. هاي نقطة. النقطة الثانية إنه flattening the curve is important because the disease is new. 7 billions باستثناء ال 1 million اللي صار diseased, we are susceptible. We don't have any immunity to the disease. We don't have any active drug. يعني لو لا سمح الله صار معي disease, I don't have any active drug that I know that I can take now. It will help me. زي ما صار مثلا بال H1N1 اللي هو كان outbreak أصلا قبل فترة وكان epidemic. We don't have vaccine. So talking about 0 cases very soon, I'm not sure. I hope إن شاء الله إنه السبيشالست يعني السبيشالست والepidemiologists والinfectious disease specialists they are هم اللي عندهم معلومة. بس أعتقد من اللي قرأناه إنه إحنا we are talking about a period of few months where we might still have certain cases. بس the government restrictions will help us to be sure that the cases will remain inside homes, inside houses or the hospitals. Maybe we might end up having 0 cases زي ما حكوا for 10 days and then we start going back to our lives gradually. But remember that we cannot live endlessly والمطارات والحدود مسكرة. ف it's not delaying the numbers, but maybe spreading the numbers rather than having 0 cases. As I talked about reinfection قبل شوي, I don't until now there are sporadic cases. I think what we are talking about is having immunity, وبالتالي the patient who are having the disease they are not having it again. بعرفش اذا ري انفكشن قد يكون له علاقه بالميوتيشن ولا لا. I'm not sure. possible لانه في different strains. I think في maybe 3 or 4 or 5 strains now of the coronavirus too. same thing بالنسبه للين. ما عندي معلومه تمام هلا. Is it sufficient to apply hygiene and wipe hands with alcohol without washing hands with soap? Remember, this is very basic. This protein has an envelope that has a lipid bilayer with glycoproteins اللي هم السبايك. هاي الليبيد bilayer, this lipid bilayer, I will go just to show you. This lipid bilayer the best weapon to get rid of the virus is cleaning your hand with soap. It is hydrophobic. والصوب كلنا بنعرف انه بيفوت بالليبيدز لايبوفيليك وبيدمر الانفلوب. This is the best way that we can get rid of the virus. The next way, if you don't have soap, you need to disinfect your hands with alcohol. But the best way is using soap, at least for 20 minutes and covering all the surfaces of your hands. Since it is an RNA virus, is there any possibility for a mutation and starting a new cycle of outbreak? There is a possibility of mutation. هذا الجزء الأول من السؤال. الجزء الثاني من السؤال, I don't know if it will start a new cycle of outbreak or it might be a mutation that will allow the virus to be more stable, يتوطن في الإنسان, يصير more stable disease, يصير زي الإنفلونزا مثلا. بس mutation is possible in these viruses. You are welcome. According to an article released by The Guardian, genetic makeup of the corona of an individual affects the susceptibility towards this. Is this true? This link to the susceptibility of an individual to her. I don't have the answer صراحة. فبدي أطلب منك تودي لي this article as a link على الفيسبوك أو by email, و I will try to find the response, the answer إن شاء الله. Why not injecting the virus coat into human body as a vaccine? The virus coat itself, the spikes, I think because it يعني this is يعني deduction. أنا عم بستنتج. I think لأنه it might affect well ACE2 الangiotensin converting enzyme. I think. Is there any drugs that can target furin receptors? Furin cannot be targeted, زيد, لأنه furin is an ubiquitous protein that is expressed in many cells of our body in different tissues, and we cannot we cannot live without it. لأنه stopping it يعني في الانيمالز اللي عملوا فيهم knock out mutations, بحكي لكم دائما إنه to identify a gene and the function of a gene, they do knockout mutation. الانيمالز اللي عملوا فيها knockout mutation الفيورين اللي وشالوا الفيورين منها, الانيمال cannot live. فاحنا يعني this protein is important. It is expressed in almost يعني all of our cells. As we learned before, we should only prescribe antibiotics for bacterial infection. But now it is one of the treatments suggested. No, it is not suggested as an antibiotic. It is suggested because azithromycin has some antiviral effect. And also it helps to protect from any overinfection. بس الهدف الأساسي إنه الازيثروميسين has some antiviral effect. What about the changing protocols in dentistry after this pandemic? This what we were talking about. Protocols will change. We don't know yet in what direction or what would be the new protocols. I think this will this pandemic will change our lives, I think, for long periods of time. I think we all will start taking care of our hand hygiene in better ways. We will take care about disinfecting and cleaning all surfaces that we come into contact with. We all will become a little bit more attentive to or careful regarding ways diseases can be transmitted through. I think there will be research windows for developing new ways of drilling, new ways to control aerosols. And I was thinking of creating a box that will separate dental chair from the operator. يصير واحد يشتغل يعني we will start working through glass protection to limit the aerosol spread inside the clinic. This will change gradually over time. Another point related to our work, I think in the United Kingdom, they are advising physicians and dentists to postpone any surgeries and any elective procedure during the next 3 months. And this is only to be able to understand what is happening and to be able to modify our protocols regarding our patients in our everyday practice. You are welcome. Is there any researches about people who get recovered? Why we could not figure out until now how their bodies managed to fight back? It's their immune system. And it's the immune system. We know how the immune system functions in relation to viral infections. We know that we develop antibodies. The problem with this disease is not the disease itself. This is a very important information. It is a new virus. It is very similar to the SARS-1 that happened in China in 2002, 2003, and it is similar also to the MERS outbreak that took place in Saudi Arabia in 2012. It's not the disease itself, but mostly it is related to the fact that it is a new disease. We know how coronaviruses infect our bodies. We know how coronaviruses get inside or enter our cells. What we are trying to do is trying to fight these in the best way possible. And because it's spreading rapidly, transmission is very fast, we need to take all the measurements that we are taking now. But yes, we have we have that we know that recovered people have antibodies. If we reach to the stage that we don't have any case in Jordan, and then airport returns to the normal work, and someone come when and he is infected, will this return us to the current situation? I think this is a deduction again, استنتاجي أنا تخيلي أنا my personal point of view. I think إنه المodalities of checking in the airports will change. We will not need only to do a security check. I think we will start to do a health check. So I can travel. I will go to a place where cases were much more, or حتى any place in the world. When I arrive at my destination, they will check on my temperature, and now we are doing. They are preparing easy tests, rapid tests that can give you a result in the next 15, 20, 30 minutes, maybe 1 hour. So they might start using that. So if I'm negative, I will be in, and when I get back again, I will be rechecked. أو Germany is doing that. Anyone who is negative بيعطوه شهادة، بيعطوه certificate إنه he is coronavirus negative. So يعني we will go back again to our normal daily life, but with some restrictions, with some modifications. ما عندي معلومة صراحة. I don't have any information. I've read that in the newspapers websites زيكم. I tried to search the drug name, but they've put a very generic name أكيد يعني to protect themselves. إن شاء الله يعني I hope إنه one of our universities will be able to put that fingerprint and be among the pioneers in finding a solution and finding a drug. Even if they did not find a drug, at least put a brickstone in that building of finding a drug that will help us treat this disease. Is S2 expression increased in patients treated with ibuprofen and ACE inhibitors? No, it's not the fact. مش هلا اللي بيصير انه الNSAIDs, البروفين, الايبوبروفين والاذر non-steroidal anti-inflammatory drugs, they inhibit prostaglandin production. والprostaglandin production from one side, prostaglandin production بيقلل الليمفوسايت ريسبونس وبيزيد الانفلاماتوري ريسبونس، وبالتالي بصير عندنا اللي بيسموه السيتوكاين ستورم، which means انه using the NSAIDs as an anti-inflammatory drug مش for chronic diseases might, and this is not يعني it is debatable. بالاول كانوا يحكوا انه there is an effect. Now we are talking differently. We think that it might be different. بس البروستاجلاندين E2 في له protective mechanism اللي هي انه it helps to inhibit الكوفيد replication. وبالتالي it is يعني debatable. We are not sure whether to, we don't know, لأنه if you stop it you might lose some of its protective mechanism, and also it might help to increase the susceptibility to disease. وبالتالي لانه مش بيزيد susceptibility to disease، لا بيزيد احتماليه، يعني it increases the risk of having the cytokine storm syndrome. But for patients who are taking NSAIDs regularly because of chronic diseases, they need to continue taking their drugs. I'm sorry, I change the position لأنه I'm consulting the other screen with the questions. Why didn't MERS and SARS turn into pandemic state as COVID-19? I need to check on that, but I think that they this virus has a different mutation. I need to check on that. Like, please send me the question again on Messenger or Facebook or email, and I will get back to you with the answer, inshallah. You are welcome, Majd. What exactly is that makes this virus more contagious than other viruses? As I told you, it is a new disease. It jumped from other species to us less than 4 months ago. Our bodies are still getting to know this virus. We are all susceptible. It uses our own viruses, our own proteins and enzymes to get inside. It uses our cells to replicate as all other viruses, but it is a single-stranded positive sense coding RNA virus. From what I've read, it is debatable. It is not a flu. In certain cases, it is more virulent. Like, it is one of the respiratory tract or respiratory system diseases. And all of them, they can present with, in severe cases, they can present with pneumonia-like symptoms. I think this is the last question. They said that children are at low risk. What about the 2 cases, one for an infant and another 5 years old child, unfortunately did not survive? I don't have the answer for that. Maybe these 2 children have other problems, have underlying disease that we are unaware of, or their immune system, they were not adapted. I don't know. I tried to find any explanation on the net. I did not find that. But we might end up understanding that people are not at the same risk. They don't have the same susceptibility to the disease. So we need some time to learn. I told you in the beginning what we are doing now. We are learning while working. All the physicians or the researchers, they are learning while working, and this is a very difficult task to do. This is a very difficult exercise because you are treating, you are learning, you go back home in the night, or this is what they are doing. They read. We already have more than 20,000 scientific publications related to COVID-19. So most of the research now all over the world is concentrating on COVID-19. So we need time to understand that. We need time to be able to answer all these questions in a proper way with better knowledge, with more facts, inshallah. Again, thank you very much for your time. Thank you very much for being here with me. I hope it was helpful, it was informative. Please, for all your questions, contact me. You have my on my Facebook page, through Messenger, or on my email. Hope to see you very soon. Hope that this situation will end very soon, inshallah. Stay safe, stay at home. Thank you very much. I'm ending now. By the way, you can come back again to the video once it is available on the JAD's Facebook page. Thank you very much again, and see you soon.